Hi, I'm Dr. Elaine, and we are going to be talking about peptides and different peptide therapies that we offer here at Holtorf Medical Group. So the first one I have here is Epitalon. This peptide is really great for anti-aging. It's a pineal peptide, and so your pineal gland, it's a little gland in the brain. It helps with circadian rhythm and a lot of our hormones in the body and other systems really work off of the circadian rhythm, which is basically the light and dark cycle in our body. This helps also with telomere lengthening. So that's the way that it helps with anti-aging. And so telomeres, they get shorter. They're like little caps on the ends of our chromosomes, which is our DNA. And those caps get shorter as we age. And so Epitalon really lengthens that. And then it also helps with DNA repair. It helps with a lot of other things as well that are associated with aging, like decreased immune function, with sleep quality. So it's really great overall for anti-aging. So this is a go-to. Okay, so next we have the GLP-1s. So first we have Semaglutide. So this is the original GLP-1 agonist. And so this helps a lot with weight loss. So if you think of Wegovy or Ozempic, this is the actual ingredient in that. So it decreases appetite and it also slows your gut motility down so that you're slowly digesting that food, which also tells your body like, hey, I'm full. This works on one receptor. So semaglutide is one receptor versus tirzepatide. So tirzepatide works on two receptors. So it's GLP-1 as well as GIP. And so this one is actually a lot stronger and more effective than semaglutide because it works on two receptors. And it actually has less side effects than semaglutide. The brand names for tirzepatide are Mounjaro or Zepbound. Tirzepatide is the active ingredient in that. So it works in the same way. Side effects are really just nausea, constipation, but that's mostly because you're eating less on these peptides. Some people get vomiting, but that's usually if they eat too much or if they eat things that they're not supposed to be eating, like sugar, of course, and alcohol. It does decrease cravings for those two as well. So those are like some good benefits on top of the weight loss. Other benefits are that they're actually anti-inflammatory, especially for the nervous system, the neuron. Next, let's see. We have, this one's pretty well known. It's BPC 157. And this is probably touted as like Wolverine peptide because of its healing properties. It's very well tolerated for a lot of people or patients. It really generally, like, you can't overdose on it. That's how well tolerated it is. It's touted as the Wolverine peptide. It helps a lot with healing injuries. So I use this as injections along with PRP or other regenerative therapies into knees and joints to help heal the area. And we can also use it orally. This right here is the injection, but you can also take it orally with our BPC 157 capsules to heal any gut issues. And it's basically helps heal anything and everything, as well as it's anti-inflammatory. Next, we have growth hormone. It can be used in adults if you have like less than 200 of your IGF-1 marker, which is how we test for growth hormone in the body. And growth hormone declines as you age. So this is also another great anti-aging peptide. It's helpful for recovery from injuries, especially like TBIs or concussions. And then it also helps with body composition. So if you're not really interested in semaglutide or tirzepatide to lose weight, because you also can lose muscle mass with that, You can pair it with or alternate it with some growth hormone peptides, like either growth hormone itself or something like CJC, Ipamorelin, which helps induce your own growth hormone production or acts on the growth hormone receptors. But this is growth hormone itself. You can use it for more of that muscle mass and fat loss combination. It also is really great for sleep as well. NAD stands for nicotinamide adenine dinucleotide, and it is a cofactor or coenzyme that's present in all of your cells, and you need this molecule to make your cells work, especially in the mitochondria, which is where it works. And so NAD helps to make ATP, which is what your energy currency is in the body. Your mitochondria, they are the powerhouse of the cell. So if you don't have your mitochondria working properly, then your cell's not going to work properly. And so that's implicated in aging, as mitochondrial dysfunction. It's also implicated in a lot of chronic fatigue, fibromyalgia, a lot of these chronic conditions where your body basically is weak. If the ATP isn't being made, then the cell's not going to work and you're going to feel fatigued and sluggish. And so it's really great for anti-aging as well. NAD can be in the form of IVs. The Biebers and the Kardashians have made that popular, but you can also inject it straight into your muscle. I recommend this a lot to patients, especially the ones that we see here at Holtorf Medical Group. Next is a new one we have. This hasn't been prescribed yet, at least that I know of, but this one is really great. It's actually a combination of peptides. It's called Glow. It's an aesthetic peptide, basically. So it has a combination of BPC-157, GHK-copper, as well as TB4, so thymosin beta-4. So BPC-157 is the master healing peptide, and then TB4, thymosin beta-4, is also helpful in healing and rejuvenation. So those two paired together help a lot with any kind of injuries. GHK-copper is another really great peptide, especially for collagen production, for your skin, for any wrinkles, preventing wrinkles or helping to reverse some fine lines. Also, it can help with hair growth. I think I would use this. I would pair it with microneedling, Potenza machine, which is radiofrequency microneedling, and put it topically, actually. I think that's a great idea. Do I need an outro? So that was it for this set of peptides, and there are a lot more. We have, I think maybe 10 more peptides, 10 plus more peptides to go over. So stay tuned. There'll be probably another part 2 and maybe 3 to go over those.